demonstration today is the arrangement of anterior teeth, upper and lower anterior teeth. This is the artificial teeth. It's made from acrylic. This is the upper anterior and this is the lower anterior. And this is the upper and lower posterior teeth. When we arrange the anterior teeth, this is the represent the upper and this is represent the lower. So if I want to arrange the anterior teeth, I remove the tooth from this side, the left side or the right side, and put it in the right side of the articulator, because this is represent the face of the patient. There are many principles aiding us for arrangement of teeth, like the midline. This is the midline, and this is the occlusal plane or the occlusal surface. First, we put the anterior central incisor, left or right, and then the lateral, then the canine, and after I finished one side, I begin with the other side. I remove from the wax a suitable amount of wax, and then we put the central incisor. Starting from the midline, and then try to put the central in its position. If it is not fix its position, I remove the tooth and remove another amount of wax till the central or the tooth take its place. And always I keep the posterior part of the wax to support the tooth. First, the incisal edge should be with the occlusal plane. How can I know the occlusal plane? I must use the table to know the occlusal plane. If I don't have the table, I can use the straight bench. The bench is a straight surface, I can use it. But for the demonstration, I will use the table. When I put the vitrum with the tooth, I see there is a distance between the incisal edge and the table. So I must raise the tooth till the incisal edge touch the table, that represent the occlusal plane. When the incisal edge touch the occlusal plane, that means it is in the long axis or the long axis of the tooth, parallel with the long axis of the articulator. The long axis of the tooth will be parallel with the long axis of the articulator, or the long axis perpendicular to the occlusal plane, that represent this table. Second, it should have a labial incline. When I see the tooth, the incisal edge, it is anterior to the neck. When I put the lacron, I see the incisal edge only touch the neck of the tooth, doesn't touch the lacron. That means it is labial incline 2 mm with the level of the wax, if my wax is right. can see it. I will remove this part of wax to be able to see the incline. You see, the incisal edge is anterior to the neck, and the incisal edge should follow the curvature of the arch. It is not straight. It is follow little distal incline or distal rotation. This is the central. Okay? When I agree to my arrangement, it is right, so I must fix the tooth with the wax so as not to move when I put the other tooth. And always keep the labial surface clean from wax to see the angulation and to see the whole part of the labial part so as not to rotate it on the other side. Again, we repeat, the long axis is perpendicular to the occlusal plane or parallel to the midline. Second, labial incline. Third, should be with the curvature of the tooth. And the incisal edge, it is with the level of the occlusal plane. Now, we arrange the lateral. We remove a suitable amount of wax. And try it in its position. If I need to remove, yeah, I need to remove from this side. The lateral incisor, the incisal edge of the lateral incisor should be above the occlusal plane. When I put the occlusal plane, I see the lateral incisor should be over the occlusal plane by 1 mm, not touch the occlusal plane. Second, the long axis should be distal incline, not straight line. It should be distal incline. Also, it should have a labial incline. And follow the curvature of the arch. It should follow the curvature of the arch. Now I should fix it with the remnant of the wax. Now we should arrange or put the canine. put the tooth, artificial tooth, in its place, the wax should be melted, not hard. It should be melted. The canine, first, the tip of the canine should touch the occlusal plane. As we see, the tip of the canine should touch the occlusal plane. Second, the long axis should be perpendicular to the occlusal plane, like this. And it should not have a labial incline. As I see, it is labial incline. So I must do it in a manner that it's not a labial incline. The neck, it is with the level of the tip. I should support the neck of the wax. Again, the tip should touch the occlusal plane. The long axis is with the perpendicular to the occlusal plane. There is no labial incline. The canine should be prominent and follow the curvature of the arch. You see the curvature of the arch. We follow the curvature of the arch. The crown of the tooth should be clean from the wax to see the angulation and the relation of the teeth with the tooth with the other teeth. When I finish this side, I begin with the other side. The same principles. You see the same principles. The incisal edge should touch the occlusal plane. The long axis perpendicular to the occlusal plane. Labial incline and follow the curvature of the arch. is over the occlusal plane, distal incline, the neck distal incline, and labial inclination of the labial surface, and follow the curvature of the arch. Now with the canine, the same principles. The occlusal plane touch the tip touch the occlusal plane, the long axis, and there is no labial incline. It's a prominent, and you see the curvature of the arch. Follow the curvature of the arch of the tooth. Now I should remove this part of wax so I can arrange the lower teeth and put the hair wax to support the teeth. Clean all the palatal part or palatal surface of the anterior teeth to have a good relation with the lower teeth. As we see, we clean all the palatal surface or palatal part of the upper anterior teeth to facilitate the arrangement of the lower anterior teeth and have a good relation between the upper and the lower anterior teeth. And from the labial surface, we added here a wax to support the teeth. The wax should not cover the labial surface, only the neck of the tooth. It's begin with the neck of the tooth and to the record base or the base plate. When we arrange the lower anterior teeth, it depends on the upper. When we put the lower, it depends to the upper. So, when I work with the lower, I need to check it with the upper. Start with the lower central incisor. Started with the midline. The lower central should over the occlusal plane to have the relation of the overbite and overjet. We check the midline and check the relation between the lower central and the upper central. I see the midline, it's not go inside with the upper, so I must remove it till it have the relation between the midline. I will remove this pen to have a good view with the central. You see, the midline is with the midline. And when I see it from inside, there is a relation between the lower and the lower and the upper. The incisal edge should over the occlusal plane by 2 mm. This is the overbite, and there should be a space between the palatal surface of the upper and the labial surface of the lower. This is the overjet. You see it now? There is a space. You see the central, it is over the occlusal plane, and when I put it with the central, you see there is the overbite and overjet relation. The lower anterior teeth, it's depend completely to the upper, the relation overbite and overjet and the midline and the vertical dimension. Now it is in its place. You see it is with the long axis, the incisal edge is over the occlusal plane, and I have the relation of the overbite and overjet. Now we put the lateral, the same as the central. Long axis and have the relation with the upper, the overbite and the overjet. I check it with the upper. As we see, the relation of the upper overbite and overjet. And the vertical dimension and the incisal edge above the occlusal plane to have the overbite. Now we put the canine. The canine should be distal incline, and the tip should be in the pressure between the distal corner of the upper lateral and the mesial slope of the upper canine. You see, there's distal incline, and the tip should be in the pressure between the distal corner of the upper lateral and mesial slope of the canine. You see, when I close it, the tip, it's exactly in its place. That means my work is in the teeth in its exact position, and the relation, it is normal and true. You see? It is in the pressure between the distal corner and mesial slope. And there is no space between the upper and the lower. But there is overbite and overjet. Now we start with the other should never force the tooth to go inside the wax. The wax should be soft when I put the tooth, so I can move the tooth in any direction I want easily. Check the relation between the central and the upper central. Have the same relation of the other side, the overbite and the overjet. Now the lateral. I need more space in the wax. Check the relation of the upper and the lower. The overbite is good, but the overjet is more than 2 milli, so I should change it or reduce the overjet. I rotated the teeth. Now I see the overbite and the overjet. It's okay. The same as the other side. Now the last tooth is the canine. At first I should hold the wax around the lateral so as not to move when I put the canine. The neck should be distal incline, little distal incline. Now check the relation. It is okay, as we see. The tip should be between the distal corner of the upper, lateral, and medial slope of the lower of the upper canine. the same. Now we must clean the lingual side of the anterior teeth and support the teeth anteriorly labially with the wax. But first we can check our incline, the curvature of the anterior teeth by put them directly to the arch. You see, it is the same curvature of the arch. It is the same curvature of the arch. We can check it by this method. Midline to the midline, and the curvature is exactly like the arch. You should be careful when remove the excess wax so as not to move the teeth.